I'm Jenna Schrage, and I'm coming to you live from my kitchen. For those of you who don't know me, I'm an FNP at ENT and Sleep Medicine, and today we're going to talk about sinus irrigation. I have a lot of patients that I tell on a daily basis to use either a sinus rinse or a sinus irrigation 1 to even 3 times daily to help with allergens, bacteria, and clean all those things out. I have a lot of patients that get pretty nervous or anxious about using these sinus irrigations. So I'm going to walk you through it and show you that it's very easy and it's something you will get used to. So why sinus irrigations? It's actually saline, which is an isotonic solution, and it's actually thought to work primarily by clearing mucus encrusting, but it also provides moisture to the nasal passages. Saline irrigations may also work by improving the function of the lining of the sinuses and by removing allergens and also bacteria and other inflammatory agents. So it's a really good thing, and it's not medicine, which is the best part of it. So you can use it as many times as you want. You can buy them at your local pharmacy. What I prefer is the NeilMed Sinus Rinse. It's similar to the neti pot that you'll hear a lot of people talk about. I prefer the actual sinus rinse bottle because you can control the flow, whereas the neti pot, if you've seen it, looks like a little teapot and you let gravity do its work. This way you control the flow so you can get it done as quickly as you want. So basically what you would do then is buy the package. If you get the big box, it's like less than $15, I really think, at any local pharmacy. And then it comes with its own little pre-mixed packages. There's 50 packages that come with the bottle. And they look like this, and this would be your isotonic solution. Some of the docs will ask you to use a hypertonic solution, and that would just be using 2 packets instead of just 1. So today I'm going to show you isotonic, which is the very soothing solution for your nasal sinuses. So what you would do is you need to heat or boil the water or use some sort of distilled or filtered water of some sort. You can't just use it straight out of the sink, tap water, or well water. So what I prefer is boiling it, and I just boil it with the teapot that I only boil water in, I guess I should probably say. And clearly it's not hot anymore. It's no longer boiling. I need to mention that. We are not putting boiling water into our nasal passages. That is not the trick. You got to let it cool down to body temperature, and I actually like it a little bit warmer than body temperature. That's my preference, but you need to find what works for you. In order, some patients say that it stings or it burns. Using too cold of water or too hot of water could be what causes it to burn. Also, not using the entire packet could be what makes it burn as well. So you definitely want to make sure that you get the entire packet into your bottle. So take the lid off, and you would empty 1 entire packet into your bottle, and then you add your water. Again, cool down to body temperature. Kind of like a baby bottle. You would test it like on your wrist to make sure it's the right temperature. I have been doing this for so long that I know exactly how long to do it, to boil it and then to let it cool so that it works. Clearly you do you and find what works for you. So let me show you. There is a water fill line, and that gives you exactly 8 ounces. You'll see on the back it says water fill line, and it's this dotted line around the top of the bottle. So you'll want to fill it to that. The packet is already in there. Put your lid back on. And then there's a hole in the top of the lid that you'll want to cover with your finger and give it a couple of shakes to make sure it's completely mixed. Now, clearly it's not carbonated, so it's fine to shake it. So once you have it mixed and ready to go, then you're ready to irrigate your sinuses. And I'm actually not going to do it today. I'm going to have my assistant do it for you. But what you want to do is, clearly you would have your hair in a ponytail, and you'll see you're leaning over your sink, usually likely in your bathroom, not in your kitchen sink. I just didn't want to bring you into my bathroom today. And you want to, it's going to go through your sinuses and come out the other nostril. So let's say you start with your right nostril, you want to lean over your sink, looking down into your sink, and kind of tilt your head to the side you want it to come out. So if you're putting it up your right nostril, you want it to come out your left nostril. So into your sink, lean to the left, into the nostril. So come on over, assistant, hop on up here. You can introduce yourself if you want.
My name is Elsa.
Okay, let's put down Jay.
Okay.
Okay, ready? She's been doing this since she was a newborn baby. Again, it is completely safe for kids to use as well. So she's completely used to this, and she knows to even ask for it if she's stuffy or congested. Stop. Okay, look into the sink, and we're gonna go up and then angle your head. I should have put your hand here, but angle your head towards me. Can you see? Yeah. And we go, ready, in. Now you can either hold your breath or breathe through your mouth. You clearly just don't want to try to breathe through your nose. Okay, so I use about a half a bottle in each nostril, and that's on a regular day. And again, I say do this daily, not just when you're sick. So then we turn your head towards this way, and we go up the left nostril, looking into the sink. And you control the pressure. So if it's uncomfortable, the other half of the bottle into the other nostril, then she is going to blow her nose. And then for adults that have full sinuses, you're going to want to lean your head over, get a couple of shakes, and you're going to get more water that comes out. Sometimes it gets trapped in some of those back sinus areas. You don't want to get to work and lean over for your work bag because it will come out like a gusher. So that's the one negative side effect, I would say, if you had to count for one. Hold on. So again, let me get where you can see me. You would lean forward. Now this is after you do the sinus rinse and blow your nose. You would lean forward and kind of let your head kind of dangle. And I usually give it a right and a left and a down, and then come up, and you're gonna feel it come out. Give your nose another little blow once it's nice and clean. Then you can do your nasal steroid. If you have any questions, please call our office and let us know. Thanks for joining me today.